I'm here to talk about polycystic ovarian disease, which is very common in the reproductive age group. It compromises almost 10 to 15% of the reproductive women hormonal disorder or endocrine disorder. What is polycystic ovarian disease and what is the symptoms? The symptom mainly is irregular periods, like more than 35 days of a cycle, or the patient might come with hirsutism, which means that is a male pattern of hair growth. We'll see hair growth in the face and also in the chest area. And when we do a scan, we see the ovary has lots of small cysts, okay, which is and the volume of the ovary is also big. Okay, these are all the symptoms and signs of polycystic ovarian disease which we commonly see in our clinic. Patient will compromise from 15 years when they start menarche to around 40-45 years. They can come with polycystic ovarian syndrome. And how does the treatment happen? The treatment depends on what the patient wants, how the patient presents with. If the patient is presenting with irregular periods, then the treatment will be for correcting the irregular periods. We give them hormonal pills so that the patient will be taking the hormonal pills and the periods will be coming correctly for her. For 6 months she will be taking the treatment, and after 6 months we usually stop it and see if the periods is becoming regular or not. And the other one which we commonly encounter is they are anxious to conceive and they are not conceiving. Why they are not conceiving is that in polycystic ovaries they have follicle maturation is arrested. A normal reproductive cycle, a menstrual cycle will be like a follicle grows on the 14th day, it ruptures, ovulation happens, and either periods happen or the patient is pregnant, okay, if they are in the reproductive age group. But in polycystic ovarian disease, the follicle maturation is arrested. There is no growth of follicle and there is no ovulation, and hence there is no periods coming properly, and also the patient is not able to conceive. So we give them medicines like cyphine, letrozole, and also injections to make their follicle grow, and we track the follicle and tell them how to have a timed intercourse, and then we'll see how she is responding. This patient might require 3 or 4 cycles or 6 cycles of ovulation induction, and then we'll track how it is going. And the other is the main treatment is lifestyle modification. Okay, when you reduce your weight by around 5%, there will be a change in your disease pattern. This is the definite treatment for polycystic ovaries. There is no definite medicines for polycystic ovaries, only lifestyle modification and diet. A balanced diet, exercise will make your disease pattern come little less. And other thing is obesity. Most of the polycystic ovarian disease, they are obese because they have insulin resistance, and that makes them little obese. And so the lifestyle modification and diet again comes into the picture, and you will have to go to a dietitian, make a diet plan, and then follow the diet plan. And when you reduce your weight, then your disease pattern might change. I will not say that disease will disappear, but the pattern might change, the symptoms will reduce, and definitely you will have a regular periods, or if you are anxious to conceive, then the conception might occur spontaneously also without any help. See, there is no medicine to treat polycystic ovaries, so there is no point in going from hospital to hospital. It is like just follow up with the same doctor, and then she will give you a good advice. If you have any queries regarding polycystic ovarian disease, or you are facing the same problem, you can come to Apollo Hospital. I'm available from Saturday to Thursday, okay, morning and evening. You can come anytime and consult.